Hi, my name is Ashlie Davis. I'm an FNP student at ASU. I did a research project over mammogram screenings, and it's titled A Comparison Analysis of Women Ages 50 to 74 that have had mammograms within the primary care setting. This is the poster I made for Create AState, and in the following slides, I will talk about each section a little more in depth, describing the parts of the research project. The introduction and purpose just starts talking about breast cancer in general. Breast cancer is the most common cancer in women and the second most frequently diagnosed malignant tumor worldwide, with an incidence of about 12%. Each year in the U.S., about 245,000 cases of breast cancer are diagnosed in women and about 2,200 in men. Of those, 41,000 women and 460 men in the U.S. die each year from breast cancer. Having mammograms is associated with a 19% reduction in breast cancer mortality rates, which is why it's a good idea to get them done. In 2009, the United States Preventive Services Task Force made new recommendations for women ages 50 to 74, recommending routine mammography every 2 years. According to the National Cancer Institute, the latest statistics show that 71.6% of women aged 50 to 74 years had a mammogram within the past 2 years. The primary objective of this study is to compare the percentage of women who are having mammograms routinely ordered at a family practice clinic in Paragould, Arkansas, to the national average of the mammograms ordered. By evaluating the results of this study, it is determined whether the clinicians in the family practice clinic are ordering mammograms more than or less than the national average. The results will shed light on the provider's performance, and they can use the data to make improvements in their use of screening tools. This was a descriptive study done at a family practice clinic in Arkansas through a retrospective chart review. We used 50 electronic health records of women ages 50 to 74 that were seen in that clinic. Simple mathematical calculations were used to figure the percentage of those women who had a mammogram ordered. The charts I reviewed in the clinic included women ages 50 to 74 who had been seen at the clinic between the dates of May 1st, 2019 and November 30th, 2019. Patients that were excluded from the study were men, women who were younger than 50 or older than 74, and women who had had a previous bilateral mastectomy. As you can see in the graph, the study found the rate of mammograms ordered in this family practice clinic for qualifying women was 72%, leaving 28% of women who qualified that did not have them ordered. When reviewing recommendations by the task force to give women 50 to 74 years of age biannual breast cancer screenings, the family practice clinic in Arkansas's rate of mammograms ordered was almost the exact same as the national average. They had 72%, the national average is 71.6%. Based on the evidence of proven research, mammograms do decrease the morbidity and mortality of breast cancer. Knowing this and how easily achievable this is by ordering at a visit such as a yearly wellness, it is still not being done on every woman in this age group. More than 25% of qualifying women did not receive breast cancer screenings as recommended by the task force in the family practice clinic or in the nation. There's definitely room for improvement in ordering screenings to decrease the risk of breast cancer mortality. The last two slides is an acknowledgement to the faculty of the Family Nurse Practitioner program at ASU, as well as the references used for this project.